Mandate applies to buses, ferries, and schools K through 12. But with so many people getting COVID, many wonder if the recently authorized COVID pills are right for them.
Sabrina Wilson looks at who the pills were intended for and why one of the pills may not play well with some other prescription medicines.
The Omicron variant remains a force to be reckoned with.
It is still very, very aggressive in its transmissibility.
And therapeutics or drugs to treat COVID-19 patients are increasing too. Dr. Fred Lopez is an LSU Health infectious diseases expert.
We have monoclonal antibodies, we have remdesivir, we now have these medications, one of which is the preferred one, which is the Paxlovid. And it's nice to have more options.
Paxlovid is Pfizer's pill. It, along with Merck's COVID pill, received emergency use authorization from the FDA. The pills are not meant for everyone.
The Paxlovid, for example, is recommended to people, again, who have mild to moderate COVID-19 illness but are at high risk for complications. And again, that would be increased age or medical comorbidity.
Folks who took Paxlovid early, within 3 days of symptom onset, had a 90% reduction in hospitalization or death compared to those that took placebos.
They seem to work quite well at decreasing hospitalizations and death.
Still, the FDA warns that the concomitant use of Paxlovid and certain other drugs may result in potentially significant drug interactions.
The Paxlovid is actually two medications. It's an antiviral medication combined with a drug known as ritonavir. The problem is there are a lot of drugs that are inhibited by the ritonavir as well. And these include, but not limited to, blood thinners, seizure medications, some drugs that are used for irregular heart rhythms, some high blood pressure medications, some cholesterol medications.
Being informed is critical.
With these interactions, you need to be aware of them and discuss them with your primary care provider, discuss them with a clinical pharmacist.
And Dr. Lopez says some people may want to check with their physician in advance about whether they'd be able to take the COVID pill.
If you are on some of these medications, to address them now with your primary care provider to see what would you do if you got COVID-19.
Lopez stresses that the COVID therapeutics are not a substitute for vaccination. I'm Sabrina Wilson, Fox 8 Local First.